We'd like to call the next speaker, Dr. Kelini Saolapurkar. And she'll be speaking on measurement of change in angle kappa and its correlation with ocular biometric parameters, pre and post phacoemulsification. So TTL sir is not there. So Dr. Harsh Kumar will be the discussant for this topic.
Good evening, one and all.
Sir,
I'm not able to change the slides.
Okay.
Yeah. So the angular misalignment between the pupillary axis and the visual axis, known as angle kappa, has been implicated to play a role in the centration of multifocal intraocular lenses and in ablation zone centration in laser refractive surgeries. However, there is a limited available literature on whether angle kappa is a constant entity or changes during cataract surgery. So our primary objective was to observe this, and the secondary objective was to see if there were any factors which are correlating with this change in angle kappa. Also, synoptophore being the gold standard for measuring angle kappa, we used this instrument in our study. This was a prospective observational study done at Shankara Eye Hospital, Bangalore, between October 2020 and May 2021. We included all patients who were planned for elective cataract extraction with monofocal IOL implantation, having a vision of 6/18 or better. And in case of any ocular pathology or previous history of ocular surgery, or in the event of any intra or post-op complications, they were excluded from the study. After obtaining informed consent and noting the demographic details, the following parameters were assessed pre-operatively and on day 7 post-operatively. And for angle kappa measurement, we used the synoptophore by Baliwala and Homi, and this was the angle kappa measuring slide. Under monocular viewing conditions, 3 consecutive measurements were taken, and the 0 mark would mark the line of sight, and the corneal light reflex centered on the pupillary center would mark the pupillary axis. And depending on whether the corneal light reflex was observed nasal or temporal to the center of the pupil, a positive or a negative angle kappa was recorded. So the minimum sample size was calculated to be 50 eyes, and the statistical analysis was done using descriptive statistics, using Pearson's correlation coefficient, and the student's PET-T test was used to calculate significance, and a P less than 0.05 was considered significant. We observed 54 eyes of 42 patients, having a mean age of 63 years. These were the mean preoperative ocular biometric parameters, and a significant change in angle kappa was noted following cataract surgery. This change ranged from no change to up to 5 degrees post-operatively, and the majority of the patients had up to 1 degree change post-operatively, and a statistically significant negative correlation was noted between corneal white-to-white diameter and the change in angle kappa. So this is a low-S curve showing the inverse correlation between change in angle kappa and corneal white-to-white measurement. And to summarize, a significant change in angle kappa was noted in our study post-phacoemulsification, and for every 1 mm increment in corneal white-to-white diameter, there was a minus 2.42 scale reduction in angle kappa, and the prediction of the change in angle kappa could be done based on the corneal white-to-white measurement. The merits of our study was that synoptophore, which is the gold standard, was used in our study, and the drawbacks were that very long and very short eyes were not included, and a larger sample size would help us analyze the change in angle kappa better. Thank you.
Thank you. Dr. Harsh Kumar. Take.
Again, how sensitive was your test that you could accurately predict 1 degree or 2 degrees?
Sir, the angle kappa measuring slide has letters and alphabets which are separated at a separation of 1 degree. And because synoptophore is still a subjective observation, we ensured that a single observer was observing the patients pre and post-operatively. And also the interpupillary distance which was measured on the synoptophore is again subjective. So the IPD which was measured for a patient pre-operatively, the same IPD was maintained by the same observer post-operatively also.
No, you see what happens is, as you correctly said, synaptophore is a subjective measurement, and it's dependent on the observer at that time to see whether, you know, it could be the same observer, but that same observer could be subject to errors of a degree or more when he's yeah. So that's
Yes,
a
sir.
little drawback also of this study. Yeah.
Yes, sir.
Thank you.